Chronic pain, or pain lasting more than 3 months, costs the economy $34 billion a year. It's a problem that affects 1 in 5 Australians, but in many cases doctors are simply too busy to properly treat the condition. Professor David Morris from the University of Virginia says patients need to take the lead in managing their own pain. He's an academic who's advised doctors in the US and is speaking to healthcare providers at Parliament House in Canberra.
The figures I've read for Australia say 1 in 3 adults over 60, 1 in 5 under 60. Very large national problem, and the national costs are immense. Figures I've read say something like $34 billion. In the U.S., the figures are astronomically high.
So given this problem is so widespread, what's going wrong when patients visit their doctor?
Well, that's hard to encapsulate as one thing, but one thing that you hear a lot from patients is that they have felt disbelieved by their primary care physicians, mistrusted. There's good evidence to say that people respond very differently to pain, and the primary care physician who understands that and who accepts the patient as face value is probably going to have a better experience with the patient. Obviously, there may be other evidence, but go with what the patient says, and you're on safe ground, I feel.
So are you saying that in some cases doctors are not listening to patients?
They can listen better. This has been said over and over for 50 years. So you can't just say to people, listen better. I think you have to say to them, here's some things to listen for. And one of my particular interests, since I was employed both by an English department and by a school of medicine, is that physicians need kind of narrative competence. They need to know what to listen for, how to deal with the story element that patients are presenting to them.
You're suggesting today that patients need to better manage themselves. That could be quite a daunting prospect for many people. So what's your message to people in chronic pain?
Well, one of the recommendations from a blue ribbon panel in the U.S. Was that patients need to be enabled to self-manage. And I don't think that means you cut loose from medical assistance, but it means you're responsible in some ways for the ideas and the thoughts that are within your own head, and that there's lots of evidence suggesting that those thoughts and beliefs and those stories we tell ourselves have a great deal to do with how we feel and how we act in the world, how we function.
Professor David Morris, thanks for joining us.
Thank you.